School Committee to order. This meeting is being live streamed by Chelmsford Telemedia and posted to the CPS website for interested community members to access and watch. Although we are not meeting in person in this particular meeting, interested community members were encouraged to submit their names and addresses to Superintendent Lang if they wanted to participate remotely under the public input portion of our meeting. During our public input session, anyone who's joined us through the GoToMeeting platform and expressed interest in making a comment will be recognized by the superintendent and allowed to speak with the committee. So welcome to this meeting of the Chelmsford School Committee. The purpose of this afternoon's meeting is to consider changes to the district definition of close contacts. With us tonight is Sue Rosa, who is a public health director for the town of Chelmsford, and Peggy Gump, who is a coordinator of nursing services. To start with, I'd like to take the opportunity to thank Sue for being with us here tonight. I know she's been very busy conducting vaccination clinics, along with continuing to monitor cases of COVID in the community. So we very much appreciate you taking time out of your busy schedule to speak with us tonight. So first order of business is we have our public comment session. So anybody who has signed up with the superintendent will now have an opportunity to make some comments. So I'll turn it over to Jay.
Sure. We had 4 individuals email me. The first one was a parent, Laurie Pellegrino. Laurie, if you want to unmute and then you can make your comment.
Sure. Hi, folks. Good evening. My name is Laurie Pellegrino. I'm at 8 Sunrise Ave in Chelmsford. So I, let's see. So, sorry, I was trying to share my webcam. Don't know if I was successful. Anyhow, comment. So in August of 2020, my husband and I spoke with our school-age children regarding going back to school and if they preferred hybrid or remote. Ultimately, we chose the hybrid option, understanding that our kids would be going to school on the same days each week in the same cohort. We would know who the kids were exposed to in their cohort, and we would be notified whenever a positive case. Hybrid wasn't easy. There were plenty of fears and tears, my kids wondering if they were exposed at times. Our family has been very cautious and has been very aware of social distancing during this time. It's exhausting. We do this because we have elder family members who count on us and rely on some type of interaction with us. We do it for my 80-year-old father-in-law, whom my husband still brings to work on a daily basis. We cook dinner for him a few times a week and keep him company as well, as he is still navigating living on his own after his wife of over 50 years passed away. We do this for my parents, who have their own health issues. My father finished his second bout with cancer this past fall. Visits with them have been minimal and typically held outside. But again, these visits have been necessary. We do this for my 85-year-old aunt who lives by herself and sometimes relies on me to bring her grocery shopping or to help her run other errands. She doesn't have anyone else in her circle. She doesn't drive. We're able to safely have some interaction with these people, partly because of the caution that has previously been exercised in the school system. I do not feel that the virus is at a point where the school system should consider making alterations to what is currently in place at the time. Vaccinations are currently underway for those ages 75 and above. Some vaccine clinics are run well, others are not. Teachers have not been vaccinated. The majority of the state has not yet been vaccinated, nor are they eligible at this time. This includes school-age children. If the school system does indeed redefine what is considered to be close contacts, change the way contact tracing is done, or modify cohorts, my family will be forced to reevaluate hybrid involvement. A change to any of this for the current school year will most likely remove the little in-person interaction my kids currently have today. Thank you.
Thank you.
Thank you, Laurie. Our next 3 speakers were Shelley Bethel, Lauren Cochran, and Katie Sullivan from the CFT. I'm not sure if you were all going, or I'll leave it up to you guys.
Okay, Katie and I, this is Lauren. Hi, everybody. Thank you. Katie and I are going to sort of read from the same letter, and then Shelley will go after that, if that's okay with you, Shelley. All right. Thank you, everybody, for having us here again. It's the 3rd time, and we're still in the pandemic. Anyway. Thank you for taking the time to hear some of our concerns regarding the return to normalcy in our schools. We know that tonight you're going to discuss possible changes in school protocols that were put into place for COVID-19 regarding quarantine and other guidelines, such as number of students in buildings. We as the staff certainly want nothing more than a return to normal. However, until pool testing is implemented correctly in the Chelmsford public school systems, and until all teachers are vaccinated, we are hoping that the current protocols, which have been working, remain as they are?
The union has offered its help with regards to pool testing, and we are hoping that this initiative gets started as soon as possible, as it has in other towns. We still have many vulnerable Tier 1 employees who are not given remote assignments. And until the staff have been vaccinated entirely, we believe the current protocols have been successful and should remain in place. We also want assurance that those teachers who are remote will continue to remain remote for the remainder of the school year. Thank you.
Thank you very much.
Shelley?
So my statement, hang on, let me pull it up here. Okay, so I come from a point of speaking as a teacher and a parent. I have a 7th grader, a 10th grader. They're both in Chelmsford Public Schools. And I know that what we've been doing is working. It's a pain. Sorry, my home phone is ringing. Of course it is, because I'm speaking. It is a pain when a teacher has to go out on quarantine. We realize that. And then the entire class or at the middle school level also has to go out on quarantine. Again, a big pain for everybody, but it's worth it. People feel safe. I feel safe. It's worth the 10-day quarantine. If they get tested, they can come back earlier. I do believe that one reason for this change is to try and keep teachers in the classrooms. I get that at the high school, it's a big disaster. But inevitably, the students are still going to have to quarantine. It's not going to keep more students in school because they sit next to different people in each class, which puts them to a close contact with all the other students in the class at some point. Even at the middle school and elementary, well, I don't know about elementary, but middle school, they're in 4 different classes, so they're still sitting next to different people. So eventually the whole class is going out anyway. And teachers are supposed to be 6 feet or more away, but it's in our nature. When a student is asking a question or needs us to see something on their Chromebook, we walk over, we stand at a distance behind them, but we still have to stand close enough to help them with whatever's going on with their Chromebook or whatever it is that they're working on. I would also like to remind you about when students are in the hallways. They're not always 6 feet apart. Yes, we do have people in the hallways monitoring them, but there's more of them than us. And so despite our best efforts to keep them separated, they're still super close together and the cohorts are getting mixed. I would also ask you to consider the many Tier 1 and Tier 2 staff that were denied the ability to work remotely, who have chosen to come into the buildings because they cannot afford to take a leave. Like Lori Pellegrino said in her statement, by changing this policy, you are putting those at risk who are a Tier 1, who have health concerns of their own, as well as the family members that people who don't have health concerns, the people they take care of, are also being put at risk. And parents will have to change their status of hybrid to go to remote, and that will be detrimental to their students who have been there all year. I'm asking that you please keep things as they are. We have only 4 months left in the school year. Let's not try to fix something that isn't broken. Thank you.
Okay, is that it for participation? Okay,
Yes,
great.
yeah.
Thank you all for your comments. So do any committee members have any public input that they received by email that they would like to share at this point? Anyone?
I think you
Jeff?
received it too, Dennis.
What's Jeff? I think you had your hand up.
Jeff, you're on mute.
I received the same email. I think we all did, concerning just a parent, Erica Redner, who had opted to go hybrid with the understanding that close contact would stay the same. And then just concern that if we make a change, that might have to make her change the option for kids. I think we all got that one.
Any want to share any other ones? I mean, I could do a quick summary of both the pros and cons. We've seen probably about equal numbers of people that are looking to not have us change, and people that are looking for us to make some changes. To what we're allowing for in-person learning and all that type of stuff. So if people want me to do a quick summary, I can do that, or they're very similar across the board. Is that okay with everybody? And if I miss something, you can just let me know. Okay, so just basically the major points of people that are against changing. Our definition is the district has been doing a good job so far, so why change now? As was mentioned, families made the decision of what model to choose based on the original close contact definition, and they may have to consider changing to remote if changes are made. Several emails mentioned changing the definition would add to the stress for students and parents, and also the fact that it would be difficult for teachers to monitor students throughout the day in terms of their distances. On the other side of the issue, again, people mentioned we were doing a good job so far, that there has been no cross-contamination or any instances of spread through the schools. So changing the definition wouldn't seem like it would have much of an effect on the spread of the disease. COVID data in the town and state been trending lower. Several people mentioned other towns around us are moving more forward in the direction to make changes to allow for more in-person time for students. And then also people mentioned that there are some students that are struggling with our current model, and any sort of changes we can make that will provide them more learning opportunities in school would be a benefit. I wanted to make mention of one email in particular. I had questions that for Sue and for us. So Hannah Barker wanted to know from Sue when she speaks, what are the recommendations on timing of this change if we were to take it into consideration, considering impending vaccines for teachers and staff and the more traditional COVID variants? And then again, when Sue has a chance to speak, can you speak to the chain of reporting positive cases from the Board of Health to the schools and vice versa? And towards us, she wanted to know, have we been able to collect any data on the past few weeks of how many students will be affected with the new definition versus the old, and how does changing the definition play into our larger plan for getting students more in-person instruction? So anything I missed? Anybody? Donna?
I thought we had one email from a parent that wanted it read in, and I think it was Teresa Evans. I could be mistaken.
Yeah, I try to get hers had many of those same points. If you want to read the whole thing in, you may. I try to summarize.
I think Maria has it, but only because she requested it.
Okay.
Yeah, I
If you
have
want
it
to-
right here. Let me just read it, because I think what she says is it's also what Lori said in many ways. So it says, good evening, Dr. Lang, Dr. Hirsch, and school committee members. I write regarding the proposed change to close contact definition. My comments may be read as they are written during the public opinion portion of the school committee. In August, we chose the hybrid option. At this time, we had several discussions with our children about what that meant, who they would come in contact with, and what the risks were. Based on this information and weighing the value of in-person instruction versus remote, we chose hybrid and have been pleased with the vigilance in which both schools that our children attend have managed the situation. The teachers have been very responsive to any particular concerns I may have had regarding spacing, safety precautions, and learning in general. The schools have notified us when there has been a positive cases. It's not been easy, and there has been a lot of stress and anxious moments. However, all of our kids agree that it's worth it to see their teachers 2 days a week. At home, our family is cautious about where we go, how we behave, and who we see. We do this because I also take care of my parents who are elderly and not in the best of health. These are the compromises we chose to make, balancing our kids' education with their mental health, balancing the needs of my parents with the behavior of my family. I'm sure we're not the only family in town making these sacrifices, and we are able to make these choices partly because of the caution exercised by the school system. Things seem to be going as well as can be expected in school. I've heard many teachers and even administrators comment that they didn't think we'd make it past Columbus Day or November 1st, and yet here we are. With so much still uncertain, I don't understand the rush to make a change. We haven't been given any numbers as to how many kids changing this vaccination would help in school. I think this change would also put undue burden on teachers to know who might have gotten up during class, who might have met someone in the hallways, on the way to the bathroom, who might have been lingered outside of class. Should we be asking teachers to be making notes on all student movements, or to use the limited time they have to teach? I do not believe that things have changed in such a significant way as to warrant a change to in-person learning at this time. Much of Massachusetts is not yet vaccinated. You have told parents that teachers are again bumped down the list. The new variants are spreading more quickly than the original virus. Lastly, in August, parents were told that the cohorts would be separated by different days and the entire classrooms will be quarantined if someone is infected. This and the decision to take the recommended guidelines and provide the maximum safety precautions with spacing played a large part in our decision to choose the hybrid option. I feel that we were given to understand these guidelines would be in place for the entire year. Families could choose at the end of each quarter if they wanted to change from one plan to the other. I do not agree with the changing the game plan now in the middle of the year and say, well, a parent will have the choice to have their child go remote if they don't agree with this change. It's unfair to families such as ours. Why should my child possibly have to go remote at this point because you want to change the way we were told things would be? Why are my child's needs, which at this moment are to have face time with their teachers and small human interactions with the others in their classes, suddenly at risk because you want to change something that, while not perfect, is working? Thank you for considering my opinion as you make this decision. Teresa Evans. That's the one I got that said read in full. I think you summarized the others correctly.
Okay. All right. Anybody else have anything that we might have missed in terms of input from the public? Okay, great. So we'll move on to new business. I think it'd be best if we hear from Sue first and her thoughts on this issue. And then Donnie, you have a question before we?
Hang on. No, I do think though that before we hear from Sue, I think that we do have to clarify a few things. Okay, so we are not talking about changing anything with cohorts, correct? At this time, that's not what we're talking about tonight.
No, tonight, the real focus is just around our definition of a close contact and how we have, we basically have maintained, and there was confusion around this, so I want to make sure this is clear. We adopted a 6-foot distancing in our classrooms. We agreed to that with our unions at the beginning of the school year. We've maintained that. There are some districts that are moving from 6 feet down to 3 feet.
3 feet, right.
There was some DESE guidance that came out that said that that would be permissible at this point. We're not doing that. We agreed to do the 6-foot distancing. That's actually still the recommendation within the CDC guidelines.
Right.
So we're maintaining 6-foot distancing at this point in time. We're not contemplating changing that. We
Okay.
also have identified, oh, I'm sorry. Can I?
No, I just want to make sure we're at this point, right? We are not talking about doing anything with the blending cohorts or anything like that. Correct?
No, the only thing that we have done since the beginning of the school year, and it will continue, is we have been identifying some of our high needs special education students. We are identifying some of our L students. And then as the spring progresses, we will look for other populations of students if there is space within the schools where we can accommodate students to be able to bring back more in-person kids. When it comes to some of our special ed programming, a lot of it is substantially separate. So if you have a life skills class, or if you have an ASD class in one of our schools, those kids are together in a cohort by themselves anyway. So if they're in 2 days a week or they're in 4 days a week, they're by themselves with the same staff. So that's been occurring since the fall. We've opened that up. I know all of our schools are assessing, again, their special education students, the IEPs, trying to see if we can go, if there's room from 2 days to 3 days or 4 days. The only way that would affect the cohorts is if in the event someone or that particular person ever did contract COVID and was COVID positive, we would basically have to quarantine both cohort A and B at that point. But we haven't had to deal with that because primarily the cases where we've added 3 and 4 days to date have been special populations. So we have not been having to really deal with that. We will need to start talking about that going into the spring as we look back to bring, say, more students back if we have openings. I would like to be able to take advantage of that.
Okay, but we're not talking about that tonight.
Tonight's discussion really is only centered on our definition of the close contact And we've been pretty consistent that it's been the CDC definition of being within 6 feet of an individual who tests positive for COVID within or for more than 15 minutes in a 24-hour period. So that has not changed, and that will not change. The only thing that we're considering, and I was asking for some flexibility on, is our reaction to that when someone is identified as a close contact was basically to have the entire classroom go out, whether they were within 6 feet or not of that individual. There have been circumstances that have come to date, as well as we'll go through the spring, where based on the testing, the number of students that we're identifying as close contacts when we send the whole class out, the test results come back after they test, and they have been negative. So we're not seeing spread within the schools. We're really over-identifying the close contacts. So what we wanted to be able to do was, again, to keep kids in if we could, is we would certainly identify anyone who's been within the 6-foot radius of the student who tests positive or staff member who tests positive. They would absolutely have to quarantine. But if there were other students in the classroom that we could confirm were not within that distancing, they may be able to stay. The case where I see this happening the most is really at the upper grade levels. And again, it would be a case-by-case basis taken in consideration with, say, Peggy, our nurse coordinator. Sue from the Board of Health helps us with the close contact identification. If you have a teacher in high school who has a student in the classroom who tests positive, and let's just say our classroom attendance at the high school for in-person is relatively low right now. So you may only have 3 to 5 or 3 to 6 kids in a classroom in person. So let's say one of those kids does actually test positive. We would obviously identify that student, and we would identify anyone within a 6-foot radius. Let's say, and this has happened where the teacher has said, listen, I was nowhere near these students. I can confirm for you that I was not within 6 feet of these kids, because as you get up in grade levels, the teachers actually have less kind of close time with the kids. It is difficult in the elementary school, and we would always err on the side of caution if there was ever a question, and have no problem putting a whole classroom out if we had to. But at that secondary level, if you're talking to the students, which are really young adults at that point, and you're talking to the teacher, and the teacher says, I have not been within 6 feet of this student. He sits in the back of the class. We've had no real contact that particular day. Instead of having to send the teacher out, because again, they've certified and they want to stay, if they're allowed to do that, that basically isn't impacting their other 4 classes, because our teachers at the high school are teaching 5 classes. Yes, one might be affected, but by having that teacher go out with the class, even if they're not part of the close contact, you're basically affecting 4 other groups of kids. So if we're averaging, say 4 or 5 kids per class, that's a good 20 kids that are affected that don't have the actual teacher in front of them, when the teacher may say, yes, there's no way I was a close contact. If the teacher said, yes, if there's a question about it, I was a little close because we were working on a particular project, err on the side of caution, we're going to consider you a close contact, you're going out. That would be on a one-on-one type basis, but we just wanted some flexibility to be able to potentially keep kids in class, keep staff in class, if they can attest to the fact that they weren't within the 6 feet during the particular point in time. So I just want to make sure that's kind of what we're talking about tonight, not the increased programming, things like that. That'll be discussed and rolled out later on this spring.
So the reason I asked that was because I do think it's important for people who are watching to understand exactly what we are talking about tonight, because there's a lot of concerns in people's emails that we are not addressing tonight. We're not making any changes in the social distancing. We're not increasing the numbers of the schools in the building. We're not modifying cohorts at this time. So like I said, I just wanted to make sure that, before we spoke with Sue, that people really understood what we are talking about tonight. And it may be that will alleviate some of the concerns that people have at this time. Sue, thank you so much for coming tonight. I greatly appreciate it. We feel like you guys are the experts in this, and we are eager for your guidance.
Thank you. Thank you for having me. When Jay first asked me if I would come, I said, are you serious? Another meeting? Because we have been doing 24/7 for, well, we're coming up on a year already. Who would have thought that we'd still be at this last March? But, I want to start by saying that I want to give the school department, I want to give all teachers kudos, because I was one of those people that thought, nope, we'll be done with in-person teaching by the end of October. And so the school has done a fantastic job. Teachers have done a fabulous job with adhering to the guidelines that were set forth. And, you know, when the guidelines were set forth before school started back in September, that was after numerous meetings between Jay and myself and Peggy and Darcy, my public health nurse. And I think everybody is in agreement as well with the constant everyday changes from Department of Public Health around this virus. And of course, they know more than they did, you know, coming up on a year ago. With that being said, we actually were able to go into our state public health reporting system today, because I was just curious, because we truly don't have an exact number of students within the school department that have tested positive just in Chelmsford alone. Now, Jay, how many students do we have? 15, 1,600? That's just at the high school, right?
Yeah, we're about 5,000 as a whole district, but we have about a third in fully remote learning at this point. So, I mean, ballpark wise, I'd say we have 3,500 students participating in some type of in-person hybrid learning, and another 1,500 that are fully remote.
Okay. So I just want to give everybody kind of the rundown of what happens when someone tests positive. So if someone is symptomatic and they go and they test positive, obviously they're supposed to stay home until they get that test results. And ideally, every other family member should stay home as well. And once that confirmed positive case hits our electronic reporting system, that's when we get notified of it at the health department level. Now, sometimes Peggy ends up finding out before we do, or a school nurse ends up finding out before we do, because the parent will call and say, my child tested positive, because they got an email confirming that diagnosis and it hasn't hit our system yet. The way that it runs at the state level is we technically do not consider somebody confirmed until we have that lab result. And then that's when we start that case investigation, and we collaborate and we speak one-on-one with the parent. We speak with Peggy. Sometimes we speak with the school nurses to find out what that student's schedule is, what their class schedule looks like. Did they take a bus? When were they in school versus when their symptoms started? So we usually try to start with the parent to find out exactly when those symptoms started, because that's how we identify close contacts. Close contact right now by CDC and the Mass Department of Public Health is defined as someone that you are within 6 feet of for more than 15 minutes in a 24-hour period. And Chelmsford has been overly cautious since day one, and we agreed on this before school started when Desi was talking about going to 3 feet, and we at the health department said, absolutely not, we don't support that. I still don't support the 3 foot issue, but I do support 6 feet. Other communities around us are identifying those students that are within 6 feet, or those teachers that are within 6 feet of the confirmed case, again, for more than that 15 minutes. Now, my understanding is that every classroom has assigned seats, so that when a student comes into the classroom, they are sitting in that same seat every day. Am I right in that, Jay?
Yes, that's supposed to be the case. And obviously, if we implemented this change, that would be something that would be critical to ensure. And we've come up with a few ways of doing that. I mentioned to you in talking to some of the staff, one of the things that they would do to ensure this, again, because this hasn't been the case, you may have someone who, switches seats because they're over 6 feet anyway, and they would have been going out. But one teacher came up with a creative idea where, like on their computer screen in their class where they're doing the online learning, they could take like a snapshot of their class so that they wouldn't have to remember who was sitting where on any particular day. They could look at the picture and actually be able to identify who was in what seat. But yes, if we were to, contemplate this and actually allow for this, yeah, we would have to have 100% assurance who was in a seat at a given time. And if there was ever any kind of vagueness or, a question about it, err on the side of caution and the whole group would go out.
Right. And then anything that involved buses, the same thing. Students should have assigned seats on buses. We know that the buses have cameras on them. So I will share a situation where we did have a student. It was a Chelmsford bus. However, it was not Chelmsford schools. And we had a student who tested positive. And the initial reaction was, well, they're sitting in their seats, they're 6 feet apart, they have their masks on. And, I went one step further and I said, well, do we know that they stayed 6 feet apart? Do we know that they had their masks on? And they went and they looked at the cameras and lo and behold, the student had changed seats and taken their mask off. And so the entire bus went out. But that was the Chelmsford policy, is that the whole bus went out. I can tell you now, I don't know how many of these, I could not break this down by school. I can only break it down by the town of Chelmsford. So if we have 3,500 students that have been attending school since September, okay, we have had 262 total cases amongst the youngest age of 6 up to 19 years old in the town of Chelmsford since school started. And what I can tell you from our experience at the health department is every single time we do a case follow-up and we identify teachers, we identify other students, the whole classroom goes out into quarantine. Multiple teachers have been tested since September. Some teachers several times because they were in a classroom, whatever. Again, kudos to the policy because people have not tested positive, and it's because masks are being worn like they're supposed to be. We have had a couple of staff members that tested positive, but that was not in school spread. It was household spread. What we're seeing for students and spread, again, is not necessarily in school spread. What we're seeing is sports outside or gatherings outside. That's when we're doing the case follow-up, this is the information that we're receiving. So, I have to say, and I totally appreciate the concern that parents have about changing because we are, into February already. But I feel very confident that with the 6-foot rule, with the current quarantine guidelines, if you are identified within the 6 feet and it's more than the 15 minutes, then you are identified and you go out into quarantine, and then you can test on day 5 after exposure if you so choose, or you stay in quarantine for 10 days and get released on day 11. Those are the updated. If you're a teacher and you're identified as a close contact, you can get tested on day 5. If you're negative, remain asymptomatic, you can technically get released from quarantine and go back to school on day 8, but you still have to monitor your symptoms right through day 14 and do the mask wearing, et cetera, et cetera. So from the health department's perspective, I would support just identifying those students that are within 6 feet of that identified confirmed case.
Peggy, would you like to add anything since you're with us?
Sure, great. Thank you for the opportunity to come to the meeting tonight, and especially thank you, Sue. I know how straight out you are, the past few months, so we do appreciate that you took the time. I really do feel that, when we started planning for our reentry, for, in the middle of this pandemic and trying to get kids back to school in September, we did know that our definition, originally Desi had said, let's keep, the whole class out, regardless of whether they were 6 feet or not, out of an abundance of caution. we presented that to school committee, and we really felt at that time, because we didn't know what was going to happen in the school. We were all sort of, planning, and hoping for the best, but not sure, what really was going to transpire once we finally opened our doors and had the staff and the students back in. So other districts in all the surrounding communities had pulled back, and they did the definition that the Department of Public Health and the CDC goes by, which is only if you're within 6 feet, would you be a close contact? At that point, we really felt that we wanted to be super cautious and really make sure that we knew, what was going to happen when we got into schools. And what we found was we just didn't have the transmission, that we really were seeing, we're not seeing the virus, spread within the schools. However, neither were the districts that had the definition that the Department of Public Health goes by, that they weren't seeing it either. So I do feel like that definition, that we're over identifying these kids, when you really think of it, they've only got 4 hours on a Monday, 4 hours on a Tuesday, and then they're home for the rest of the week and every afternoon. So by our definition, where we're over identifying them, we're taking them, that importance of that face-to-face interaction with their teachers. They're losing what little time they have in in-person learning because we're over identifying them. Sometimes it's just by sheer bad luck that it seems like it's been the same groups of students, not always, but Maria can attest to that it has happened that it's just kind of these certain classrooms, and over those kids, are losing that important face time with their peers, with their teachers. And I think most students will tell you they miss school. They miss being able to be in there. And we're not saying, we're going to, increase time just yet, but what we're saying is we don't want to take what little time they have with their peers and their teachers, and then time and time again, calling them a close contact when by, what the CDC, the DPH, and, Sue Rosa and the Board of Health, they're really not a close contact. And I feel like we're over-identifying them. We're pulling them from school when they could be in school if we had the correct definition, which is within 6 feet, for more than 15 minutes. And, we would continue, we would not change how we're doing our contact tracing, would work very closely with the teachers and the staff to make sure. And if there was any question, well, gee, was it 6 feet? Was it 5? I think it was. If there's any I thinks, then we just would say, we need you to, go out. We can't have an I think. We need to know with certainty that you are, you were not within 6 feet of the person who is diagnosed with COVID. And I think, the teachers, they have done just a tremendous job. They have worked so hard. And I believe that they've got this down. When I walk by the classrooms, that all the kids have the mask on, the teachers have the mask on, the kids are, maintaining their distance. I don't think it would really change a whole lot in the classroom situations we have now, because they are maintaining their 6 feet and they're doing it really well. So I really think that this would just, keep those kids in person, more often than they're not, because we're calling them these close contacts.
Thank you. Anybody have any questions for either Sue or Peggy? Donna?
So thank you, both of you. Just my first question is, Sue, with regards to this variant that we're hearing about, are there any concerns with changing the close contact rule, given that we're hearing that this is a much more contagious, virus than COVID-19 is?
They're talking about 3 times more contagious right now.
Right. So at this point, there is no change as far as close contacts being made by Department of Public Health or CDC. They have come out and said that it definitely is more contagious, but the recommendation, the only thing that they're actually saying now, they're not mandating it, whatever, they're recommending that there is probably an extra degree of protection by wearing 2 masks or like a triple layer mask than just a single layer mask. So that's basically what, and actually there was a report this morning, I want to say that they had identified, I think it was 29, and they're following it very closely. There were 29 cases, and 4 of those 29 cases had traveled. So 19 infections originally identified in the United Kingdom. So that brought the total to 29 in the Commonwealth of Massachusetts up to January 17th. And cases have ranged from 4 years to 70 years old, 13 females, 16 males. And there's been 17 cases in Worcester County, 1 in Hampden, 2 in Middlesex, 6 in Norfolk, 2 in Plymouth, and 1 in Suffolk. And they're basically saying that they're feeling right now, they haven't changed the 6-foot distance, but they're saying that if people make sure that their mask actually fits properly, you know, these people that wear their mask that's constantly falling off their face and then they're constantly touching the front of the mask. You're not even supposed to touch the front of your mask. You're supposed to only touch the elastic when you're putting your mask on and off. And you see people walk around all the time. The sides of the mask are open, the nose is hanging down. So they're talking about wearing a properly fitting mask and how that is definitely helpful. And they're saying that the masks that actually have the wire that you can tighten over your nose is considered a better choice. And then they're basically saying that if you use more than 1 layer of mask, that's what they're saying right now. And everything else is the same. Avoid the groups, stay home when you're sick, stay 6 feet away. And if you have any symptoms, get tested.
Maria, you had a question?
Yes. So first of all, what Sue just said is extremely difficult task of little kids to be consistent with that. And also it's difficult to ask that double masking of teachers and the people who are with them all the time. But in any event, that's all very important information for us to keep in mind. So let's say, how often would you be in touch with each other about the increase in spread? Do you and Jay touch base daily, weekly? And Peggy, how does the team work so people know going forward if something changes and we consider making some change here tonight, when would we retouch this issue? How would we look at it again?
So I keep in touch with Jay probably once every couple of weeks or more often than that if something comes up that we need to talk about. Peggy, we're on speed dial. 7 days, 10, 15, 20 times a day if we have to, including weekends, evenings. And Peggy's on speed dial with myself as well as Amanda and Darcy, my public health nurse, who do, kind of track the cases. We're at the point right now, because my department is so overwhelmed, that we are sending more and more cases to the contact tracing collaborative at the state level, because we just, we couldn't keep up. And especially now that we're not only doing the contact tracing, but now trying to also have vaccination clinics, which is a huge undertaking and a huge planning and coordinating effort in and of itself. So, but however, if we get the phone call or the heads up from Peggy that we have a confirmed case or a suspect case or whatever, Amanda and Darcy will pay very close attention to those, and we'll try to keep those cases in-house and not send those to the CTC.
Okay, so I do want to say that Peggy has been tremendous through yourself, the cooperation that you've given to us. So we do thank you tremendously for that. I know Peggy has been absolutely phenomenal with everybody in the system. And we appreciate that tremendously. I think parents' biggest concern, and let's think this through for a minute, Peggy, let's say that something happens in the classroom, we get an identified case, and you're going to decide who's going to be quarantined. What's the process? You go up to it let's say we would change the rule, and you need to know who was sitting within which distance. And right now, not everybody is in assigned seating. It would need to be a change that would have to happen, okay? And just as teachers may want to take a picture, students also have phones, may want to take a picture, whatever they decide to do. But when you have that and you identify that, then what happens? You go up to the teacher and the teacher has to make the decision? How does it work?
Well, currently what we do right now, we do try to protect the privacy and the confidentiality of the positive person. But in most cases, we will, if we need to, we'll ask a parent if we may disclose. And most parents are willing to do that. Sometimes at this point, we don't really need to because the whole class is going out. But we've had a situation actually where a student was identified as a close contact when, you know, they truly weren't. And that parent had called me and said, well, gee, they have a really important medical appointment. I really need to know, you know, because I don't want to cancel that appointment. I called the positive person. They, you know, said, yes, you may disclose to the teacher. And then we were to look at the seating chart. No, gee, that person, not only were they 6 feet away, they were 18 feet away. It was in a very large classroom. They were completely far away. So we would work with, you know, the teacher to look at the seating plan to determine if any, because sometimes teachers will remember to say, you know what, maybe the Chromebook wasn't working. I did get pretty close. I didn't have my watch on. If there was any hesitation or doubt that they weren't sure if they were within the 6 feet, we would err on the side of caution. But oftentimes, you know, right now we're looking at classrooms where some only have 8 students, some have 5. You know, at the high school level, sometimes it's lower than that. At the elementary, middle, you know, you see the numbers a little bit more, but, you know, maybe 10 at most. And the teachers can really often say, I know exactly, you know, where my kids were, and we were all, you know, they could tell us, you know, where they were in relationship. And, you know, it would be just be a really good reminder to say, listen, you need to really keep those 6 feet distance. And you need to, you know, if a teacher comes and speaks to you because they want to have a quick little meeting, you need to, you know, have a designated space in your classroom where you're 6 feet away and you could speak to another staff member, things like that. So we'd really have to, you know, put the message out again, just a, you know, friendly reminder that, you know, that 6 feet, you just can't bridge it. You really need to keep the 6 feet. You need to have your, you know, either egg timer on your desk or use your iPhone or whatever your, you know, to have a little, you know, alarm. I know, like if Jay happens to stop by my office or Linda, they always have their phones on, and the minute they pop their head in my door, that timer goes on. You know, we maintain our 6 feet, but we have that alarm that will tell us. So I think that would be important reminders about the time. You know, if you do need to speak to a colleague or student and you want to, you know, do that, you just need to be mindful of the time and the distance.
Okay, anybody else have any questions for Sue or Peggy at this point? Donnie, you had another question?
Yeah. So again, thank you both for coming in. I'm sure you can appreciate that when you're trying to make the best decisions for 3,000 kids and their families, and by extension, the community, you know, you want to make sure that you're getting it right. You know, there's no guarantees, I understand that. But I think that there's not a person on this committee that would not be devastated if, as a result of a school transmission, that there was a loss of life for a staff person or a student or a family member. So this is why I think that we, you know, take this so seriously, as do you in your job. I can also tell you as a teacher, there isn't a day that when I was in person and I'm returning to in person, that I was not nervous about, you know, the close contact, social distancing, and the mask wearing, that I needed to frequently remind my students that they needed to adhere to. And I do worry about the stress that this will put on our teachers. in terms of adding one more thing, because not only are they teaching in person, but they're teaching remotely and having to monitor everything else that's happening in the classroom. And I think that we need to be sensitive and aware of what it is that we're asking our staff to do. I think that they've done a terrific job so far. I completely agree with you. I think that it is amazing that we've gotten this far. And I think it is as a result of the hard work of the staff in our schools. I think that, you know, we read about things like, as I said, this variant. Another thing that came from our governing board, MASC, through the daily update was something called the COVID linked syndrome. I don't know if you've heard of that, but it was something that they sent out to us that they're finding that more and more kids are experiencing this as a result of having been exposed to COVID or being sick with COVID. And these are all the things that I think that we're trying to consider as we move forward. So I actually don't have any more questions other than to say, is there anything else that you can be thinking of that we should be aware of, you know, before we move forward? And then Dennis, you know, in terms of after that, you know, I do have some thoughts about just what we need to do as a school committee.
Yeah, what I was hoping to do was, if people have any more questions to ask Sue and Peggy the questions, then allow Sue to move on. I know she has some other things to do tonight, and then we can each, you know, have an opportunity to speak about what we feel about this particular issue. So any other questions for Sue or Peggy? John?
Just a quick question, and again, I want to kind of reiterate, I appreciate all the work you are all doing in the community, because it's an incredible effort. Just out of curiosity, have you heard anything, any kind of rumors or whatever about prioritizing teachers and staff for the COVID vaccines? It just seems like a whiff for me from the federal and state level. Have you heard anything or anybody talking about prioritizing school staff if they want to open the schools?
Not at this point. Right now, we're still at the very beginning of phase 2 and currently at the 75 or older. It was a shock to a lot of people last week when the governor basically opened up his companion program to anybody over the age of 75. And, you know, I think that some people, I think that's necessary to get some of our people over the age of 75 vaccinated. But unfortunately, I think there will be people who will take advantage of that whole system. And I think it's a shame, and we have no control over that because they just have to do their own kind of, you know, self-attestation about that. They do update the state website, the Department of Public Health website. They're supposed to update it well, they were doing it every Tuesday and Friday. I don't know that they're doing it quite as often as far as the phases. And I think everybody on this meeting knows just as much as I do how quickly and how often those phases have changed in the last month, as far as different groups of people. So I believe, I'm hoping, and I'm trying to be optimistic, that by the beginning of March, we will at least be able to open it up to 65 and older and people with 2 or more comorbidities, which we may have some staff that would fall into that category. You know, our challenge here in Chelmsford moving forward is going to be getting enough vaccine to vaccinate everybody who wants to get vaccinated, because we're not getting the doses. Lowell General was actually kiboshed on their doses last week, but then they were approved again as of yesterday. So they do have the allotment right now to do like 800 doses a day. And we are partnering with them as we move forward so that if we don't get the vaccine, we can still work as one of their partnering communities. So it's a tough call. I agree that, you know, I'm in support of teachers getting the vaccine. If I had my way, I'd give it to everybody, because more often than not, I feel like a real meanie when I have to say, sorry, you don't qualify. But it's all about the supply and the demand. And right now we don't we don't have enough vaccine. They're only allocating me as the health department right now 100 doses a week. I did put in a request for 600 for this week because in the next 10 days, I do have 2 second dose clinics coming up that total 600 people. So I'm hoping that I do get those 600 doses to give everybody their second dose. And then we just scheduled the clinic for Thursday where we had 150 doses. So when we get the doses, we're putting the clinics together and we're getting it out there. But, you know, they ask me every week what my capacity is. And I tell them that we could easily do 700 doses a week, but I'm not getting the vaccine.
We were able to do the school nurses and the direct service providers within the school system, such as the occupational therapist, physical therapist, the speech pathologist. So we do appreciate, Sue, that you were able to help us along with that. So we've made a brief start, and we have a long way to go, but you know, we're ready to help out as well with the Board of Health when we're able to get the program for the department, the school department.
Great.
Thank you, Greg.
Any other questions? Maria, you have another question before we?
It's for Peggy. So a lot of parents have asked about numbers. So when we look at this policy change, and I don't know if you would have an idea on these numbers. So far, since the beginning of school, how many students have gone out totally on quarantine? And do we know it by levels?
I actually have a spreadsheet. I hesitate to give the numbers, but I could easily get them for you and put that in a report. So I have the numbers for, you know, every student that has been a confirmed case. And then I do have the numbers for every case of how many students went out on quarantine, how many staff went out on quarantine. And I will tell you, we haven't seen, you know, a significant at all of we have had no transmission. We've had out of, say, I'm just going to throw a number out there, you know, because I don't say we've had.
It's not about the transmission. I think what people are trying to figure out is if we make this change, how beneficial is it in terms of the face-to-face, you know, in-person contact with a teacher to continue? So let's say that you quarantined 100 students, but if we change this policy, now you're only going to quarantine 50 students. Do we have an idea of how beneficial this change would be?
I think the biggest
given the
benefit,
past.
sure, given the trends and the history, I think, you know, we haven't really seen that many positive cases that have impacted the elementary in the middle. They've had a very low transmission. The high school, just because they're, you know, kind of mini adults and they're playing their sports and they're going to their outside activities as they should. Like, we want them to, you know, their life has become very small. You know, as adults, it's been hard for us. It's been really hard on the kids. But we have seen through those activities where there has been a higher transmission rate at that level. So I do think we would see the benefit more so at the high school level, because those are the kids where, you know, one positive student in 2 days, they're going to 8 classes. So each class has, say, you know, that could be 80 students that now they've been over-identified as a close contact. Now those 80 students are going to have to go out when they really weren't within 6 feet. So I think at the high school level, you would see a tremendous benefit where kids would not be missing that in-person learning because they were, you know, really incorrectly called a close contact. We haven't seen it as much at the middle and the elementary, but at the high school, I think you'll see those kids will be in-person learning so much more frequent than they have in the past few months, because the amount of time that they've had to go out by being identified as a close contact.
Okay, thank you, Peggy.
All right, any other questions? Everybody's good? Okay, well, again, Sue, Peggy, thank you very, very much for taking time out of your schedules to talk with us tonight. We really do appreciate it, and hopefully you can enjoy the rest of your night.
All right, thank you for having us.
Thank you so much.
Thank you, guys.
Okay, so what I'd like to do at this point is give everyone in the committee an opportunity to express their opinion on this matter, and then we can hear from the superintendent, and then we can decide what direction we want to go after that point. So we'll just go around, the group and give everybody their opportunity and then see where we're at. So we'll start with Jeff and see if your thoughts are, Jeff.
I think the new close contact's a good idea. I don't know if I'd want to do it the week after vacation. I just get concerned about coming back from a vacation. There are too many people traveling. I would hate to have us do the new close contact and then have it blow up and not work as well because people haven't been doing what they're supposed to do. I mean, I think, if you have a seating chart, and I think Peggy's right that there aren't a lot of necessarily large classes, so it'd be easy for the teachers to know who's sitting where. And I think the idea of taking a picture before each class so you know where they're at, I think it's a good idea. That would be my only concern, would be starting it right away. Just, I get nervous over, what people are doing over vacation. Not everyone is considerate of what their actions can cause.
Okay, great. Thank you, Jeff. Maria, your thoughts?
Well, for me, listening to this whole thing, the most important thing to me is I really think it does add a lot more in terms of the teacher. The teacher has to make a decision and has to contribute a lot more to the input. I think it's different at each level. And it would be important to me to know that if we're going to change anything, Jeff's point about waiting is a good idea, but secondly, that we give the option for the person to still consider that they are close contact if there's any doubt whatsoever, and that we do not in any way question that person's judgment. Because I can easily see that we're asking staff members to make decisions that they didn't have to make in the past. And we don't want anyone to be known as the person who always chooses to be out, or the person who always is overcautious and is scared, or whatever. I think the person should have an option to be out if they need to be out because they think they were a close contact. It would also seem that the greatest impact on keeping students in the school, because we're not making any other changes, it's just identifying who's a close contact, would be at the high school level. And if it is at the high school level, that appears to be, and I don't know enough about this, so I'm not going to say it, but I'm not going to be the one who makes this declaration, but I think there are less students coming to classes right now, even those who have chosen hybrid. So I'm not sure how much of a greater benefit this is adding, if that's the student has opted not to come in. I don't know. So, but it seems to be the greatest impact. And finally, if we're going to make this change, the assigned seating is going to be extremely important, and that's an additional requirement again in a classroom on a teacher. It hasn't been done all the time consistently.
Okay, great. Thank you, Maria. Donna, your thoughts?
So one of the things that I would like to see, right, that I really think that we need is a plan. So I'm going to call this phase 1 of phase 2. We've been in phase 1 up until this point, and now we're entering kind of a new a change and a new process for taking a look at what it is that we're doing. And I think the protocols that we have in place need to include these things. What are we going to ask teachers to do with regards to seating? And I think it needs to be consistent across the district. Okay, I think we need to be clear on what the notification process is going to be for parents, what the process will be if a student tests positive. And I think we do need to err on the side of caution. And I think that the teacher has to have the final say. They're the ones in the classroom. They're the ones who are going to know how much time they spent with students or how much time students spent with each other, in that class period. I even think we should take a look at it based on grade levels. So in the elementary school level, for example, I think it's probably a little bit more difficult to kind of keep track of it. So maybe we say if someone tests positive in the classroom in an elementary school level, the entire class goes out. In the high school level, I think the kids do stay in their seats more. It is maybe a little bit easier to keep it's easier to keep track of kids. So I think that, we have to have protocols in place for that. I think we need to know what the trigger for change is. So what happens if, things start changing in the wrong direction? What is going to be that benchmark that we're going to say, okay, we're going back to what it was that we were doing before? How do we account for the variant? And then what are we going to do about requirements for double masking? Are we going to wait till we see the variant in town? And then I also think that any plans that we have to move to the next phase of phase 2 of phase 2 needs to take into account our testing and our vaccines before we make any plans to move forward.
It kind of sounded like Governor Baker there with
Thank you so
phase
much.
2, step 5.
I don't know what else to call it, but the reason I say this too, I think this is very important. The more clearly we spell it out for people, staff, us, students, families, the better off that we're going to be. So that every step of the way they can see what actions we're taking and what the rationale behind our actions are. And if we don't do that, then I think we leave people unnecessarily stressed and anxious about what's happening.
Great. John.
So I'm kind of on the same page, I feel like, with Jeff. There's a couple things to look at. I think vacation's big. I know we're talking about it and it's not out there yet, but those new variants are really, really concerning. The rate at which they're transmitting, they're 3 times more transmissible. I just think we need to be able to make sure we watch out for it. In terms of the guidelines, though, I think I'm there in changing the guidelines. I just definitely want to put some thought into making sure we have a way to respond to a bad situation. It's just a bucket of bad choices, but I support the new CDC definition or the original, and but I really want to put emphasis on the transmissibility of the new variants because I think that's important. That's all.
All right, great. As far as my opinion, again, it's all a balancing game. Right? We're balancing safety and educational opportunities. I think from a safety perspective, the data that we've collected has shown that our schools are relatively safe, that we are doing a really good job. Our students are wearing their masks, they're keeping their distance, they're washing their hands. Our teachers are doing a good job monitoring that. The recommendations from CDC, Mass Public Health, DESE, Chelmsford Board of Health, our own coordinators all seem to feel that this would be a safe move for us to take. In terms of being able to monitor it, I can tell you from experience that it is doable. I mean, and again, I'm just working from the high school level. You have your seating charts. You know where the kids are sitting. You can keep it. You know where everybody is, and I think it is something that as Donna said, maybe it's something we have to look at differently at different levels. But I know from a high school level, it is something that is very doable. And I think the benefit of it is it just does give our kids more educational opportunities. I mean, if we're over-identifying and we're having kids quarantine that wouldn't need to quarantine, we're taking them out of that in-person learning that they need. That's the emails that we hear from people that are, asking for us more time is that their kids are struggling with this remote model. So taking them out of that in-person learning and putting them on, at home because we're over-identifying is hurting them. And I've heard from teachers too. I got a call from a teacher that had to quarantine, and he, very upset that he was nowhere near that student, but it took not only from that class, but his other 4 classes, how he had to teach from home. And while I'm sure he did a great job teaching from home, it's different. And again, telling from experience, it is different. And Donna could tell too. Trying to teach from home and trying to teach in the classroom, it's a total different ballgame. And so having to do that, because of over-identification, is going to take away from the learning experience for those students as well. So, I would like to see us move forward this and change in the close contacts and work towards other improvements. As Donna said, come up with a plan for what's our next step and what's the timelines for doing that. So I'll turn it over to Jay and see what kind of thoughts he has of this.
Yeah, I think, we've been very fortunate since the beginning of the year to get where we are. I know that was said by a few of the respondents. And really, when we did start, we were wondering, what was this going to look like at Halloween? What was it going to look like at Thanksgiving? And I think we're all thrilled that, us and all of our neighboring communities have been able to maintain the in-person learning. It has not been easy. The staff have worked incredibly hard, whether it's in the hybrid model, the remote model. This has been a very, very difficult year for everyone, and they've risen to the occasion. I think that has been super. I absolutely get, and we see the emails and even the conversations we have, there are people on both sides of the fence. There are some people that really want to be back more in school full time. There are other people that are very nervous, and I get that because they're caring for someone in their home that might be highly susceptible to, infection and things along those lines. I think we all kind of have those struggles. So I absolutely get it. And, as I was thinking about this too, we are going to have to make a plan, to Donna and Dennis and other people's points, for starting to reopen further. And I think in the weeks ahead, we'll start to lay that out so that we can let people know what we're currently thinking and what those milestones will be. I do think the pool testing will be helpful to be able to help move that. I think the vaccination will be able to help move that. But those all have to be in concert with a more robust kind of return to school, which, hopefully will happen later this spring and, certainly hopefully for next fall. But we need to start, kind of laying that out now. The one thing I have not wanted from the beginning, I think we've tried to be very amenable to people's concerns and whatnot through this whole process and really give people choice in this. They've had choice of hybrid, they've had choice of remote. When we've been able to, like I said, on some of those special ed situations, allow people to come in a couple extra days, we've really worked individually with people. We've religiously, since the beginning, been notifying people of the cases in the schools. And even when we made that revision to not notifying when outside school contacts occurred, we were able to communicate that, the reason why. And I got a couple of individuals that, thanked us for doing that. I really didn't get any negative press, whether it was emails or phone calls about that. I think because we were very forthcoming and we said, why were we doing it? And I think people do trust what we're doing. On this communication piece, again, to just be extremely transparent and maybe ease the minds of some of the families who don't necessarily agree with this. And, it's not an across the board, every time this happens now, there's not going to be close contacts, there's not going to be a class that goes out. It's probably still more likely than not at the elementary level that if a case is active in a class, just because of the age of the kids and how difficult it is to, kind of keep track of them, we're probably going to be erring on the side of caution, and that class may still go out. If the elementary school teacher themselves is COVID positive, the whole class is going to go out. We're not going to have the teacher be remote and have the kids coming into the school to be watching their teacher on a TV panel. It just doesn't work. So all this is really doing is providing us that opportunity to, on a case-by-case basis, evaluate what might be best for the situation. But as it stands now, the school would get, if there was a positive case, let's say it's at the high school. If there was a positive case in a classroom, the school is going to get a communication saying we've had a positive case at Chelmsford High School. That's still going to occur. And then if you were the actual classroom that occurred within, you would then normally now get a communication saying, it was your class, someone was positive, you're all going out on quarantine. What I would propose to do, and I think might be a nice compromise to make everyone feel kind of better in this, is on that second communication, you would get a communication saying, so-and-so, and there was an individual within the class that was COVID positive. You have been identified as a close contact because you were within 6 feet of the individual. You have to quarantine, right? That's not going to change. That person has to go out. But if we were able to identify in that class 2 or 3 people who, let's say, aren't necessarily close contacts, their parents would get an email saying there was a positive case in the class. You were not considered a medical close contact because you were more than 6 feet away from the person. This was confirmed. However, if you want to quarantine, if you decide on your own you want to stay out in quarantine and be super safe about it, you absolutely can. And then just join the class remotely for your own quarantine. But if you're comfortable that you were safe enough to come in, that you don't feel you were close contact, then you're certainly welcome to. We're not going to bar you from coming to school. But that might make families who are a little bit nervous about coming in, knowing that they're going to get a communication saying, the school has basically attested to the fact that, you are a close contact, you're out. Or you're not a close contact under the CDC definition. If you would like to quarantine, by all means do it. If you would like to come in, you're allowed to. I think that might go a long way, hopefully, to help some of these families that are a little concerned with the definition, because they on their own can still make that decision. But that wouldn't necessarily impact the rest of the class if they were comfortable coming in, and it wouldn't be taking away that in-person time from people who are comfortable doing so. So I think that might be how I would approach the communication to this whole piece. And, to Jeff and John's point about like timing on this, I'd want to have time to be able to kind of notify staff, notify the community, get everyone up to board, even with this relatively minor change. We wouldn't do it after coming back from February vacation. We would probably look to implement some kind of a change around March 1st, which would be like the first full week we come back in March after break. So that would give us a whole week to be able to tell people why we're doing it, how they're doing it, work with the teachers to make sure that they're really certain that they've got to maintain their charts, maybe offer the suggestions of taking the picture, things along those lines. So that coming in that following week, which happens to be March 1st, it could be a clean slate with that month going forward. Here's how we're going to do it. That's what I would suggest just in general. That notification piece being critical and giving parents the option of if they want to quarantine or not, if they technically don't have to. And then probably starting on March 1st as opposed to right after the break.
Right. All right. Anybody have any other questions or the thoughts? Donna, see your hand up.
Yeah, I just want to make clear that this is a milestone. Okay, it is. And I think that the emails that we've received from people indicate that they're concerned about the change. And I want a plan. Like I want a written plan, not a discussion or anything like that. I want to see something in writing that says this in this milestone or phase 1 of phase 2 or whatever you want to call it, that this is what's going to happen and exactly outline what it is that we're talking about. Because as I said, I think that this is going to set the stage for everything that we're going to do from here. And we need to be clear about it. We need to make sure that there's no miscommunication, that there's no room for misinterpretation or anything like that. We all need to be on the same page about this. And I'm talking about not just the school committee, but the staff and the families and students as well. I think that as far as the notifications are concerned, Dr. Lang, I think that's a phenomenal idea. And I think that anybody in the classroom, if a child tests positive, that everyone that was in that class, and maybe you meant to say this, will receive some type of notification, whether it was your close contact or, okay.
Well, you're either, if you're a close contact, you have to
Right,
quarantine. You have a
right.
choice.
And
But
then
if you
everyone else will get something else. Okay.
Correct.
Terrific. All right. And so basically, if you could just summarize this, what is different? Okay. Because parents may be saying, I'm really concerned about sending my child. What ultimately is different in this plan?
The only thing, if we do what I just indicated, the only thing that is different is if there is a positive case within a classroom, not necessarily the entire classroom would go out. The entire school would get a communication saying we have a positive case. The class would receive a second communication, either saying, you are a close contact, you have to quarantine, or it has been determined that you were in the class with a positive case. However, you were not within the 6 feet or whatnot. You're not medically considered a close contact. You have the right or you can own choice to quarantine, and then we expect you back on X date, or you're welcome to still continue to come to school, monitor your symptoms the way we would do everything else. So the only thing here that's really changing is there is some latitude for the school nurse, for Peggy, for Sue Rosa, to be able to individually work with a classroom teacher where there is a close contact case, in the school admin to determine, does the whole class have to go out? Which again, if there is any doubt, that's what would happen. If there is any lack of certainty around, well, so-and-so may have been working with this one or whatnot, any doubt at all, and to Maria's point earlier as well, we have really tried to work with the staff from day one on this one. Everyone has been forthcoming. If someone, it's not a mistake, but if someone has been within the 6 foot radius when they really shouldn't have been, we're erring on the side of caution. We're not second guessing someone. You're going to go out, we'll work going forward to see, is there a better way of doing something? As Peggy had mentioned, could we set up a little area in a room so that you're 6 feet apart? You don't end up in a situation where you're too close with someone. But we wouldn't be second guessing staff in this. We'd be working with them to identify, who potentially should go out. doing so and then, trying to return to a regular class later. So the only thing that's changing here is you're not automatically getting the letter saying you're out. You're either getting the letter saying you're out or it's your choice.
All right, thank you.
Okay,
Okay.
other thoughts, Maria?
Okay, so I want to reiterate, I think it's extremely important what Donna said regarding going forward. People are concerned about the thoughts behind this. Is it because we're trying to open up things and this is just the beginning and we're going to just widen the whole thing and people are scared? By the same token, there are folks out there also who just want us to return full in person. So I think it's really important to have discussions and have agenda item on what's our plan going forward. Do it little by little in terms of the discussion, but get this plan and get it down. And if it needs any kinds of renegotiations or anything, we've got to get going on it. But it's really important to do that for the community. And I like what you're proposing. I agree with what you're proposing. Dr. Lang, I appreciate that you've added in there about the staff. I think it's very important that we do not create any kind of thought amongst staff that they cannot trust each other's decisions. Extremely important. So thank you. Appreciate that.
Okay, any other thoughts? Okay, so at this point, I mean, I agree. We do have to have a plan going forward, and it's definitely on the radar for when we get into our March meetings to definitely to have discussions about where do we go from here. As far as this particular issue, if we are going to try to implement this on March 1st, and we would need to kind of come up with a decision tonight. So what I would propose is I would propose a motion to support a change in the close contact designation, the CDC guidelines starting the week of March 1st, utilizing a notification process described in tonight's meeting. And that would then cover what we just talked about here. Does that seem reasonable? I'll take a second.
Seems good to me.
Okay, we have a motion, a second. Any other discussion? Any changes that you want to make to the motion?
Yeah, no, I don't want to make any changes, but the thing is that, and I don't disagree, but I also want to make sure that, there's things that we don't know yet. Like, so for example, we haven't told staff that there has to be some type of seating assignment or tracking system, okay? We haven't, outlined for staff what exactly it is, that they're going to be responsible for doing in the classroom. I mean, I think we can say in good faith, sure, we want to do this, but I really want to see a plan. I don't think I can emphasize that enough. Okay, I want to see what this is going to look like, and I'd be happy to vote provisionally, but I don't want to not have something definite in place because we don't have anything in place. Definitely.
Again, I think we all agree that we need to have a plan going forward. I think this is a step, and I think given that we're not going to be doing it till March 1st, if that's we go with that motion, we do have a week to notify the staff and say, hey, listen, we might have to make sure we have seating plans. You need to monitor this. For this particular item, I think that we've covered what we need to cover, or at least my opinion. And going forward, I agree. We should have a plan of what's the next step and when do we want to implement that and why do we want to implement that. This particular issue, I think that we've had, I mean, in my opinion,
but this is the next step. So Jay, when can we expect to see something in kind of writing about how this is going to, roll out in the schools?
Are you talking about this specific element or are you talking beyond this?
No, just this.
No, I would be working on my communication that would go home to families, when we return from the break, a communication that would go to staff. And I'll be meeting Monday after the break with the building admin to be talking about return to school planning for the spring. So it would be part of that meeting as well. And we would roll this out to staff next week when they return to vacation so that they would know what the expectations is, what the changes are. what, potentially could happen if someone was positive in their class, that there would be a conversation to see who would need to quarantine, who wouldn't. I'd be able to roll that all out next week. And if I, felt comfortable that we had our, all of our ducks in a row, we're ready to go, that's when we would implement it. If it wasn't ready to go for Monday the 1st and there's a question, I wouldn't do it. I'll start, Wednesday or Thursday. There's not like a defined timeline, like when we have to switch to this new system. I think what we're just doing is giving the option would be there where it wasn't previously, but we're still evaluating every single case on a case-by-case basis.
Yeah, no, I don't think that's what I'm saying. I think so let me give you an example. We have a meeting on next Tuesday, but that's the budget hearing. Okay. For the following meeting, could we have a memorandum in our packet that kind of outlines what all the steps are that I may have mentioned tonight?
What I just said I'd be doing?
Yeah, or, for example, that we're going to be asking teachers, what it is that we're going to be asking teachers around seating assignments, what the notification process is going to be.
Yeah, what I can do is I can share with you as a committee, I can email you whatever communications that we end up as a district sending out to the staff
Okay,
when they return from vacation.
perfect. All right, let's start with that. Thank you.
Any other comments, questions? Everybody okay with the motion? You want me to read it again, or are we good?
Good.
Okay, so we'll just go roll call since we're online. Jeff, are you in favor or up against?
Yes.
John,
Yes.
Maria,
Yes,
Donna?
Yep.
Okay, myself, yes. Great. All right, thank you all. I just want to remind you, and Donna already did, so next week is our budget meeting on next Tuesday. So that'll be the main focus of that meeting. Then we have another meeting the following Tuesday. So if anybody has any agenda items they want put onto that agenda, I'll please email me and I'll do that. One of the things I do want to do is do our mid-year review of our goals. And we're past mid-year, but we didn't set them till later either. So if anybody has any thoughts on that particular point, just email that and I'll include that in the report. And other than that, I thank you all for spending an extra Tuesday night and going through this. So any final comments or anybody has?
I greatly appreciate you setting this up. I'm glad. Thank you very much for listening to our concerns at the last meeting and doing this. It's greatly appreciated.
And I appreciate it, particularly Sue and Peggy for being with us too. That's, they've been very busy people. So, okay, well, if that's it, then I will entertain a motion to adjourn unless Maria, you had something? Sorry.
Dennis, can we also please thank all the parents, staff, and everybody who contributed their input? It was invaluable.
Okay, I think you just did. Yes, but thank you. Yes, we get some great feedback on both sides of the issue. So yes, thank you to everybody. So I will take a motion to adjourn.
I move that we adjourn.
Second?
Second, Jeff,
Aye.
John,
Aye.
Maria,
Aye.
Donna,
Aye.
and myself. Aye. Okay, thank you all very much.
Thank you, everybody.
Be safe.
Thank you.
Good
Have a good
night.
night.